Coming to the Synergy platform, Synergy had a multiple trials, senior trial, Evolve short DAPT, POEM trial, Ideal LM trial. So Ideal LM was basically on left main lesion, even though in the left main lesion also they used for 1 month of DAPT. The Evolve CAPT was for 3 months. Synergy platform compared with the standard cohort, 2000 patients were taken. And you can see here stent thrombosis with DAPT, shorter duration of 3 month DAPT only 0.2%, and the performance goals was also significantly better. The co-primary endpoint of death MI, that is the ischemic event, between 3 to 15 months, because after 3 months you have changed to single antiplatelet, where in the standard group you are still continuing dual antiplatelet. So what was the ischemic event? You can see there was no difference between the two groups. Rather, the 3-month group was statistically significantly lower ischemic event. So it was not necessary that you have to go with a DAPT after 3 months even in a Synergy platform. This is a trial on senior patient more than 75 years of age. Here they tried 2 therapies, 1 month and 3 months, and in both the therapy you can see here the curve is separating in favor of shorter duration, and here this Synergy was compared with a bare metal stent again, just like what it was done in the Leaders trial. So even though it was a 1 month and 3 month, this was the 1 month data. Here you can see here all the parameters of MACE, all cause mortality, MI, stroke, everything was ischemia, different TLR, all were significantly better in patients who are a 1 month of DAPT compared to 3 months, suggesting that Synergy stent also was doing equally well even with a shorter duration of therapy. Senior trial, similar thing. POEM trial also, here it was given only 1 month of DAPT. Same data we are getting. Let us come to a third stent which we have, that is the ONYX from Medtronic company. Does it fare similar or it is inferior? They had ONYX-ONE global registry. You can see here this trial was basically unique in the sense that this trial directly compared the ONYX with the BioFreedom stent, which was polymer free. So it was a polymer based stent compared with a polymer free stent, and you can see here the results are equal. Whether when you have the cardiac death, MI or stent thrombosis rates were almost similar in both subset of groups. Myocardial infarction, stent thrombosis, almost same. So similar thing in the global registry also, they found the same thing. So this was 1 month of DAPT in ONYX patient compared to BioFreedom. So this is the ONYX-ONE clear trial, where only 1 month of DAPT was given in a polymer free stent compared to a polymer stent. And these are the high bleeding risk criteria, more than 1 were there, and 1 month therapy was given, and you can see there is hardly any difference. Cardiac death or MI between 1 to 12 months, almost same. Clinical outcome between 1 to 12 months, very similar to the Leaders trial. Myocardial infarction, stent thrombosis, all subscript of ACS, diabetic, complex lesion, renal failure, stent length more. There was no difference between the two subsets, suggesting that ONYX-ONE also gives a same efficacy like that of a polymer free. This is the Ultimaster stent from the Terumo company. Again, 30 days of DAPT compared to conventional. There was no difference between the MACE event. You can see here the abbreviated DAPT had a better outcome compared to the standard DAPT. So suggesting that in the current generation, the newer generation of DS, all are having similar outcome. What are the other options which we have to reduce other than changing the stent? Because newer stents are all doing well. What are the therapy? Can we think of a 1 month dual antiplatelet therapy followed by clopidogrel? Because currently the standard is after DAPT we change to aspirin only. So will clopidogrel monotherapy after a DAPT will be better than aspirin monotherapy? STOPDAPT-2 trial. You can see here the outcome with a clopidogrel therapy. Definitely clopidogrel gave a better net clinical benefit, ischemic benefit compared to only aspirin, suggesting that it gives a better antiplatelet activity with less of bleeding risk. So 2.4% compared to 3.7%, which was statistically significant. Major secondary event, again there was no difference between the two. The major bleeding point, again the major bleeding point, if you can see here, the DAPT had a higher compared to single. 1 month was better compared to 12 months of therapy. So 1 month DAPT followed by clopidogrel monotherapy definitely proved beneficial compared to DAPT. P2Y12 inhibitor monotherapy versus DAPT. The SMART-CHOICE trial, here they used all the stents available, and you can see here single P2Y12 monotherapy with a clopidogrel was definitely better compared to DAPT. The bleeding risk was also lower in patient who had a SAPT.